Typically, a neurosurgeon will probably go into great detail, ask you a lot of questions about your symptoms. So they'll ask you detailed questions about your symptoms, how often you get it, how does it actually feel like your headache. Is it a pinching pain or a throbbing pain or a tearing pain? Then we'll probably do some basic examination to see whether the problem is related to a disease in the brain or perhaps the spinal cord. Because a great number of patients actually have cervical spondylosis or slip disc in the neck, which can present typically as headaches rather than neck pain or arm pain. Neurosurgeon, upon examination, will be able to identify where the actual problem is, whether it's actually coming from the brain or the head or the spine. And after that, the most likely thing that will occur after that is that he will probably get some investigations done for you. And typically the investigations that a neurosurgeon will request would be an MRI of your brain and your cervical spine. This is to help localize the problem, to find the root cause of the problem. And only then, when we know where the problem is and what exactly is the problem, can we initiate or start talking about treatment. Essentially, I think consultation, examination and MRIs will probably range between 2,000 to 3,000 ringgit depending on the complexity of the MRIs that we need for the patient. That would be an average range. Consultation by a neurosurgeon runs into a few hundred ringgit, probably about 200 to 300 ringgit only. Insurance will pay for all of this. Of course, depending on your insurance policy, the insurance pays for it from the point of consultation onwards, and there are some policies which dictates that the patient pays first and claims later. So that is subjective to individual policies.